useful in preparation. I'm such a mess. Hi everyone, welcome back to my YouTube channel. It's your favorite registered nurse, Anita. I know this is your go-to for smart and simple Nclex prep. You know I got you. So today we're looking at one of the most tested skills on the Nclex, which is no other than priority setting. So knowing what to do first can make or break your answer. So let's make sure you are always choosing wisely. Without further much ado, let's dive in. Let's look at airway, breathing, and circulation, your ABC. Airway comes first. Airway is always priority. If your patient cannot breathe, nothing else matters. Either it's from an acute exacerbation of asthma or it's an epiglottitis, anything, airway is always priority. Let's say, for example, you have a patient that is confused, has a BP of 90/50, and is wheezing. What's your priority? Your priority is that wheezing, that airway. Yeah, the confusion and also the low blood pressure matters, but you have to make sure you are looking at that airway first. Airway is always priority. Your patient comes in, you can see your patient already displaying symptoms of airway problems. You don't even need to go and start assessing. You need to intervene. Mostly airway conditions will need you to intervene immediately so you save the life of the patient. For example, your patient comes in with epiglottitis, a child, and the child is drooling, has that tripod positioning. You can see all those signs of airway distress. Immediately, you don't need to start assessing. You need to prepare for mechanical intubation because that child will most likely be intubated to help to save the airway. Or your patient comes in with acute exacerbation of asthma. You can see this client is wheezing. You can see that the client is trying to catch his or her breath. You don't need to come and start assessing. There's no need for you to start any form of assessment at that point. You need to intervene immediately. You know that your clients need a short-acting beta-2 agonist. Get your clients a bronchodilator like albuterol to help to dilate those bronchioles and relieve those airway wheezing, and in turn allow the client to breathe properly. So if your client is not breathing, nothing else matters. So make sure that airway is your priority. Whatever you need to save that airway, you do it. Give it oxygen or whatever. Just make sure you realize that that is priority. So next, we're talking about Maslow's hierarchy of needs. I know we all know about Maslow's hierarchy of needs, but the question is, do we know how to actually apply it in answering prioritization questions? So Maslow actually ranked human needs according to priority. The first being physiological needs like air, food, and water. Then safety and security, providing safety for your clients, like for clients now that risk for harm to themselves and also to others around them. Client that risks for falls, and if your client at risk for falls, there are things you need to put in place like padding the bed raise, putting the call alarm within reach, putting the client's belongings within reach, helping the client to ambulate, teaching the client how to properly ambulate. So then we have the love and belonging, people having the need to feel loved, to be provided support. Then the self-esteem has to do with the person's confidence, your client's confidence. Also, there's the self-actualization. So these are the human needs in order of priority as ranked by Maslow's. So using the Maslow's hierarchy to answer prioritization questions. Let's say you have two clients. You have a client with anxiety, probably as a result of an upcoming surgery. Maybe the client doesn't have enough knowledge about the surgery, or you're just anxious about the outcome of the surgery. Then you have another client with shortness of breath. Who would you see first? You would see your client with shortness of breath first because that is a physiological need. Physiological need will take precedence over every other need. So let's look at acute versus chronic, stable versus unstable. You would always choose your unstable client over a stable client. Like, yeah, of course, we know all this, but when it comes to applying it in answering questions, we often fumble it. Also, your acute illness or your patient with an acute condition will come first before a client with chronic condition. Let's say, for example, you have a patient with COPD. I have another client with appendicitis. You would choose the appendicitis over the client with COPD because appendicitis is an acute problem and COPD, that chronic obstructive pulmonary disease, is chronic. So talking about unstable and stable clients, you have to choose the unstable client first. For unstable clients, you see words like the client is unstable, which is obvious that this client is unstable. You see the client has probably post-op of less than 12 hours. The client will have acute illness. The client is probably newly diagnosed or newly admitted or just been admitted within the first 24 hours. The client has change in assessment, or the client is experiencing signs and symptoms of which they were not originally diagnosed with, or signs and symptoms that do not relate with their diagnosis. While for stable clients, you see that the client is stable, the client has a chronic illness, probably post-op of greater than 12 hours, ready for discharge, not just newly admitted, and experiencing signs and symptoms that are in line with the diagnosis. So let's look at an example. You have two clients, a client with COPD that has an SpO2 of 90, and you have another client that is post-op reporting sudden chest pain. Who would you see first? Remember, your client with COPD that has an SpO2 of 90 is absolutely normal. Clients with COPD have the SpO2 between 88 to about 92. Ensure that low oxygen drives them to be able to breathe properly. So that is just perfectly okay for that client. So you can say that client is experiencing or showing normal signs and symptoms associated with that condition. But please don't get me wrong, there are some things that are never expected. Airway problem is not something you'll be like, oh, it's expected, and then you leave that client. You see airway problem, you see hemorrhage, you see hypoglycemia. Those are not things you'll be like, oh yeah, I expect that to happen. Let's say give a client morphine, and the adverse effect of morphine could be airway problem, airway distress, and you'll be like, oh yeah, I'm expecting that to happen, so no problem. You wouldn't. Oh, the client just had a tonsillitis. Your client just had a tonsillitis, and you can see the client swallowing often, which could be a sign of hemorrhaging. And you're like, oh yeah, I expect the client to be hemorrhaging. Those are not expected. Those are adverse effects, and adverse effects are life-threatening. So you would not expect airway hemorrhage, and all those big things are not things that you say you expect and you just leave your client to be. Please do not. You have to run to that client and intervene. So back to what we are saying. So that SpO2 of 90 is expected with that client. The client is not having any airway problem with that SpO2 of 90. They have a client that is post-op reporting chest pain. Would you expect a post-op client to report chest pain? The answer is no. So it's unexpected, it's sudden. So another client is just fresh post-op. So you want to make sure you look at that client. That's the client you would see first before any other client. And that chest pain could mean pulmonary embolism. From your knowledge, you would know that this could be a pulmonary embolism. So you want to rush to that client first, and that is also an airway problem. So that your client should take precedent. So that client is what you intervene. The client with SpO2 of 90 COPD, you just keep monitoring the client. There's nothing for you to do there. So let's look at the nursing process: assessment, diagnosis, planning, implementation/intervention, and evaluation, ADPI. But if there's a clear threat, you have to intervene first. For example, you have a new patient, you assess first. You have a client that has trouble breathing, you intervene, you don't go assessing. So it goes in that order, but you should know that there are exceptions to that rule. There are situations where you need to actually intervene immediately. So talking about assessments and implementation or intervention, it's very important to check the stem of your question to know if it's asking you for assessments or implementation. So let me break it down for you. For example, you're a registered nurse in the med-surg unit and you have a client that just returned from liver biopsy. And the question is asking you for a priority nursing intervention. So you have all these options and they're asking you what is your priority nurse intervention. You would know that you need to choose an assessment answer, because from the stem of the question, no assessment has been done, and the stem of the question does not require you to even implement. Just told you that this client has returned from a liver biopsy. I know that the major complication from liver biopsy is hemorrhaging, and that's why you need to place your client prone to actually apply pressure on that area to prevent bleeding. So your answer will be to assess the biopsy sites for bleeding. That is an assessment answer, and that's the right answer. So let's say another example, they are telling you that this client has returned from liver biopsy and the blood pressure is said to be 90/50 millimeters per mercury, and they give you options. What is your priority nursing intervention? You know that the first thing you will need to do in this condition is to implement. This question requires you to implement and not to assess, because from the stem of the question, assessment has already been done. That's why we can see that the BP is 90/50. So the next thing you need to do now is to intervene. So make sure you check out for it to know whether it's an assessment question or an implementation question. That will help you in always choosing the right answer. So in answering prioritization questions, make sure you are on the lookout for those red flags. The signs of deterioration, the bleeding, confusion, sudden change, new onset, post-op less than 12 hours. All those signs that show that the client is unstable, airway problems, hemorrhage. There are a whole lot of things that you need to check out that are always priority, like your airway is always priority. Sepsis also, hyperkalemia, because you know it can cause cardiac dysrhythmias like your ventricular fibrillation, hypoglycemia, a blood glucose level less than 70, also peritonitis, altered mental status, hemorrhage, a very high fever, let's say a fever rate of 105 degrees Fahrenheit and above, pulselessness, breathlessness. Make sure you're always looking out for all those key signs. Those show you that your client is unstable and you need to run to this client first. These clients are mostly always priority. So thank you for staying to the end of this video. I hope you found these tips helpful. So I would encourage you to practice questions on prioritization, because Nclex is big on it. Listen to my clinic audios on prioritization. Watch other videos apart from these ones on prioritization so you get grounded. But the more questions you do, the more grounded you get on prioritization. And these tips are super useful in answering prioritization questions. And if you've not watched my video on tips on passing the Nclex, which I'll leave the link in the description box, do well to watch it, because in the description of that video I actually left a lot of tips that will help in answering prioritization questions. And please, before I forget, please not forget to like, comment. Let me know what you think about this video in the comment section, and let me know what other areas you like me to discuss that will helpful in preparing for the Nclex. Subscribe and hit that notification button so you get notified every time your girl drops a new video. So I remain your favorite registered nurse and your favorite go-to for simple and smart Nclex prep. So till me again, bye bye.